Welcome to the Grenz Zone. Dissecting dermatology differently. Here is your host, Dr. Logan Kolb.
Welcome back to the Grenz Zone podcast. I hope you're all doing well and excited for another episode of discussing papulosquamous disorders. Today we'll review a very common condition that you will see every day in and out of clinic. We are talking about seborrheic dermatitis, also known as Seb Derm. It is not only common, but it can mimic several other disorders, including lupus and precancerous AKs, so we've got some really important content to cover today. So before we get started, let's quick review where we're at on our roadmap of reaction patterns, and then dive into a short episode on seborrheic dermatitis, also known as Seb Derm. We break our reaction patterns into 5 categories: papulosquamous, eczematous, vascular, dermal, and vesiculobullous disorders. It's important to remember that many diseases will fit into many categories, but this is still a nice way to start approaching a differential diagnosis for rashes. The first category that we're currently going through are the papulosquamous disorders, which refers to scaly rashes with papules and plaques. We further break papulosquamous rashes into 5 subcategories. 1. Psoriasiform, resembling the prototype psoriasis. 2. Pityriaciform, which resembles Pityriasis rosea. 3. Lichenoid, resembling Lichen planus. 4. Annular, such as ringworm. And 5. Erythroderma. We've already dedicated 2 episodes to discussing psoriasis, and we'll be talking about Seb Derm today. The other rashes in the psoriasiform differential that we'll discuss include mycosis fungoides, small and large plaque parapsoriasis, and pityriasis rubra pilaris, also known as PRP. Before we get started with Seb Derm, I'll mention our disclaimer that this episode is meant for educational and informational purposes only and should not be used as a substitute for medical advice, diagnosis, or treatment. Nor does this episode represent the views of Orange Park Medical Center, Olmsted Medical Center, or their affiliates. As mentioned, Seb Derm is extremely common, with a prevalence between 2 to 5% and a lifetime incidence that's even higher than that. If you're sitting at a stoplight listening to this podcast, there's probably at least a couple people at the light with you that have Seb Derm. Regardless, it can affect people of all ages, so I will break it down into 2 discussions: seborrheic dermatitis affecting infants, which is often called cradle cap, and Seb Derm affecting post-adolescent adults. Regardless of age, seborrheic dermatitis classically presents as erythematous patches with overlying greasy yellow scale that commonly affects what we call the seborrheic areas, which includes the sebum-rich areas of the scalp, face, chest, and intertriginous areas. Seb Derm is caused by a lipophilic commensal yeast called Malassezia furfur, which is spelled Malassezia-fur. Malassezia furfur, which is also known as Pityrosporum ovale. It lives on everyone's skin but loves to grow on these oily, rich areas. So it makes sense that Seb Derm shows up in these sebum-rich areas and actually used to be cultured in olive oil. Some people are more susceptible to Malassezia furfur, which is likely due to the composition of that patient's oils on their skin. People with Seb Derm have higher levels of triglycerides and cholesterol, and low levels of squalene and free fatty acids in their sebum. There are also lower levels of the bacteria P. acnes in Seb Derm skin. P. acnes converts triglycerides to free fatty acids that are antimicrobial. Therefore, if you have less P. acnes, you have fewer triglycerides being converted to the antimicrobial free fatty acids. Therefore, Malassezia furfur can grow like crazy and cause what we see as Seb Derm. This inverse relationship between Malassezia and P. acnes growth may also be due to the fact that there's only so much real estate on our skin for flora like Malassezia or P. acnes to live on. So, a couple good quiz questions that you may get from attendings like Dr. Grumpypants are:
Take a break from dreaming about your next vanilla mango latte and tell me, what other dermatology conditions does Malassezia furfur cause?
The answer is, besides Seb Derm, Malassezia can also cause neonatal acne, tinea versicolor, and pityrosporum folliculitis. Another question you may get is,
Oh, get this question right, and I'll give you a purple participation ribbon. If you see severe seborrheic dermatitis in a patient, what are some associated disorders you should think of if you are in fact capable of forming any conscious thought?
There are two correct answers, one being neurologic disease and the other being HIV or AIDS. People with neurologic disease such as Parkinson's disease or epilepsy may have refractory seborrheic dermatitis for reasons that aren't exactly clear. Interestingly, there are reports of patients with a history of stroke with unilateral nerve deficits having unilateral Seb Derm on the affected side. As far as HIV patients go, they are more likely to have Seb Derm, possibly due to their immunosuppression. Therefore, their Seb Derm often improves as their immune system improves with antiretroviral therapy. If you have a patient with seborrheic dermatitis that is refractory to treatment, you could ask about risk factors for HIV, such as multiple sexual partners, IV drug use, etc. Besides these associations with neurologic disease and HIV, there are common triggers for seborrheic dermatitis as well. Severe emotional stress, which suppresses our immune system due to cortisol release, can bring out Seb Derm. Fun fact, our body normally excretes about 20 to 30 milligrams of cortisol daily in adults, which is equivalent to 5 to 7.5 milligrams of prednisone daily. When we're under physical or emotional stress, this cortisol release can increase 10 times that amount, equivalent to 50 or 75 milligrams of prednisone. Stress is no joke. I had a patient who developed severe seborrheic dermatitis that came to clinic in early April, and it turns out that they worked as a tax collector and were having a ton of stress in the heat of tax season. With treatment and getting past the stress of tax season, the patient's Seb Derm went away. Other triggers for Seb Derm besides stress include sun exposure, heat exposure, or fever, all of which are similar triggers for rosacea as well. So let's sum some of this up before we talk about the subtle clinical differences between Seb Derm in infants and adults. Seborrheic dermatitis is extremely common, with a prevalence of 1 in 20 people. It is caused by the yeast Malassezia furfur that grows on all of our skin but tends to affect patients whose sebum has higher levels of triglycerides and cholesterol and lower levels of squalene and the antimicrobial free fatty acids. Seb Derm can be triggered by stress, immunosuppression, sun exposure, heat, and fever, and is associated with HIV and neurologic conditions such as Parkinson's disease. So let's talk Seb Derm in adults first. It affects males more often and has a peak onset in patients' 30s to 50s, although it can occur at any age after puberty when our oil glands wake up. Seb Derm classically presents as greasy yellow scales overlying background erythema on many locations, including the scalp, upper forehead, eyebrows, glabella, eyelids where it is known as blepharitis, nasolabial folds, in and behind the ears, and even on the back, in the umbilicus, and around the genitals. When Seb Derm affects the scalp, it can take on many forms that are on a spectrum. Dandruff represents the mildest form and does not have significant erythema. In the middle of the spectrum, you have classic seborrheic dermatitis that we just talked about, and then these plaques can become thicker and are sometimes referred to as sebopsoriasis because the plaques are thicker than what's seen in usual seborrheic dermatitis, but they're not quite thick enough to be full-blown psoriasis. Seb Derm is generally symmetrically distributed, especially on the face, and may have itching and burning associated with it, so don't let that throw you off. Seb Derm may cause hyper or hypopigmentation in darker skin types and can also have uncommon complications. One such complication is pityrosporum folliculitis, which presents as itchy follicular papules and pustules, classically on the upper forehead. Another is that Seb Derm can be a rare cause of erythroderma, which means that 90% of the body surface area is impacted by the disease. Some conditions on the differential for Seb Derm on the scalp include psoriasis, tinea capitis, and chronic contact dermatitis. Psoriasis usually presents as more circumscribed, thick, silvery plaques that are less itchy and patients likely have plaques elsewhere on their body along with the nail changes, so do a thorough skin check if you aren't really sure. Tinea capitis presents in younger kids aged 3 to 7 who don't get Seb Derm because they're prepubertal and they're not infants. And there are classically broken hairs to go along with the erythema, along with posterior lymphadenopathy. Patients with contact dermatitis may have more pruritus and may have also started a new product recently, such as a shampoo. The differential for seborrheic dermatitis on the face includes rosacea, which can often coexist with seborrheic dermatitis, actinic keratoses, whose scale are less yellow and less greasy than Seb Derm, the malar rash of lupus, which spares the nasolabial folds, whereas Seb Derm likes to involve that fold, dermatomyositis, whose heliotrope rash is more violaceous than the blepharitis caused by Seb Derm, but remember, dermatomyositis can also have scalp dermatitis. And then there's tinea faciei, which has more annular plaques that are often asymmetrically distributed on the cheek.
Let's move on to a patient group that could probably answer these questions better than you. How does seborrheic dermatitis present in infants?
It characteristically starts 1 week after birth as the classic erythematous, sometimes itchy patches with greasy yellow scale that usually resolve by 4 months of age. It affects similar areas to adults and is classically seen on the scalp, where we call it cradle cap, along with the face, postauricular areas, the sternum, and intertriginous areas. We will dedicate a whole episode to the differential for intertrigo and diaper dermatitis later on down the road. But what else should be on our differential for cradle cap or Seb Derm on an infant's face? Atopic dermatitis is a big one. Atopic derm usually starts later, usually between 1 to 16 weeks, compared to infantile Seb Derm, which is usually around 1 week. Atopic dermatitis is more likely to affect the face in the flexural areas and is often correlated with a family history of the atopic triad, which includes atopic dermatitis, allergic rhinitis, and asthma. Another clinical pearl is that atopic dermatitis tends to be more pruritic and more inflammatory than Seb Derm in infants. Other conditions on the differential for cradle cap include psoriasis, which is very uncommon and has more adherent scales, and tinea capitis, which affects older infants and kids and is associated with broken hairs and posterior lymphadenopathy. Another PIM question that I've had is,
what syndrome can be associated with extensive seborrheic dermatitis in an infant?
This is a tough one, but the answer is Liner's disease, spelled Liner's disease. Liner's disease, which we believe is caused by a defect in the complement system, presents with severe generalized Seb Derm, diarrhea, recurrent skin and internal infections, and failure to thrive. So, how do we diagnose and treat Seb Derm? While it is most often a clinical diagnosis based on the appearance and the location of the lesions, we can also consider a KOH prep or a biopsy when we aren't sure. KOH scrapings may be helpful by showing the spaghetti and meatballs referring to the hyphae and spores of Malassezia, although this often isn't done in clinic since it is often unreliably positive. Another question you might get from attending is,
so what would a biopsy of seborrheic dermatitis show? Your answer will suffice without any emojis or hashtags.
The answer is regular acanthosis, which becomes more irregular in chronic lesions. Remember that acanthosis refers to a thickened epidermis. The regular in regular acanthosis refers to the fact that the reedy ridges all dive down to around the same depth, whereas irregular acanthosis means that the reedy go to different depths. So besides acanthosis, Seb Derm classically shows spongiosis and something called shoulder perikeratosis, which means the perikeratosis is concentrated at the edges of the hair follicles where they reach the surface of the epidermis. So besides a KOH or a biopsy for the workup, remember to consider HIV testing if risk factors or severe disease is noted, along with zinc testing for infants with intertrigo where you want to rule out acrodermatitis enteropathica. Finally, once we've reached a diagnosis of Seb Derm, how do we get these patients better? In general, we use topical anti-inflammatories and antifungals. So let's focus on adult patients first. When it comes to Seb Derm on the scalp, shampoos go a long way. Depending on the severity of Seb Derm, patients should leave the shampoo on their scalp anywhere from 5 to 30 minutes, and patients can apply it to dry scalp and leave it under a shower cap for longer applications prior to rinsing if they have more severe disease. Patients can alternate 2 to 3 shampoos used 2 to 3 times weekly. Over-the-counter options include Selsun Blue or Head & Shoulders, which may contain the active ingredients selenium sulfide or zinc pyrithione. Other shampoos to consider in the rotation include ketoconazole, cycloperox, salicylic acid shampoos, or tar shampoos. For African American patients who cannot shampoo their hair as often, topical steroid solutions, oils, and foams can be very helpful for these patients, along with medicated shampoos used once to twice weekly. When seborrheic dermatitis affects the face or external ears of adults, topical antifungals such as ketoconazole or cycloperox may be used alone or in combination with a mild topical steroid such as hydrocortisone. You will want to counsel your patients on not using topical steroids for more than 2 weeks if possible. It is very important also to counsel your patients on the chronic nature of Seb Derm and teach them that they can only control but not really cure their disease. Having realistic expectations makes life easier for everyone and can take a lot of unnecessary frustration away. It's also helpful to teach patients that once their flare is controlled, they should do maintenance therapy using their topicals or shampoos on the weekends to keep their disease from flaring. Some other treatments to consider include the calcineurin inhibitors, which include tacrolimus and pimecrolimus, both of which can cause burning as a side effect. For patients with bad Seb Derm on their face, they can also use the shampoos we mentioned earlier as a cleanser to wash their face. When it comes to treating infants, reassurance goes a very long way, letting the parents know that it will resolve in the upcoming months. If treatment is desired, parents can gently wash the scale with mild no-tears shampoo or use a mineral or vitamin E oil to massage the affected areas and remove the excess scale. If this isn't cutting it, medicated shampoos such as selenium sulfide may be tried, along with hydrocortisone or ketoconazole cream. So that about does it for a quick episode on a super common condition, seborrheic dermatitis. So let's finish with a quick summary. Seborrheic dermatitis is extremely common and caused by the yeast Malassezia furfur that loves patient sebum that is higher in triglycerides and higher in cholesterol, and sebum that is lower in squalene and the antimicrobial free fatty acids. Remember that Seb Derm can be triggered by stress, sun exposure, heat, and fever, and is associated with HIV and neurologic conditions such as Parkinson's disease. Seb Derm tends to affect the scalp of infants, where we call it cradle cap, and for adults, it also loves the scalp and the ears, glabella, eyebrows, and nasolabial folds. For all ages, Seb Derm can also affect the intertriginous areas, the upper chest, and even the back, umbilicus, and genitals. It is usually a clinical diagnosis, but biopsy will show acanthosis, variable spongiosis, and shoulder parakeratosis. Treatments for adults include a variety of shampoos, including selenium sulfide, zinc pyrithione, ketoconazole, cycloperox, and tar shampoos, along with topical antifungals such as ketoconazole and mild steroids such as 2.5% hydrocortisone. Infants can be treated with similar treatments, but we usually take a more conservative approach and start with gentle no-tears shampoo or mineral oil or vitamin E oil massages before we reach for the medicated shampoos, the topical steroids, and topical antifungals.
All right, my friends, thanks so much for listening. If you want to support our content, please share episodes with a friend and leave a positive comment for us. Creating this content also takes significant expense, so any donations to help cover our costs can be made via PayPal or Venmo using the donation link on our website, grenzonederm.com. And that's with 2 Z's, grenzonederm.com. I want to share many thanks to our team that has made this content possible, including Drs. Karthik Krishnamurthy, Sean Schmieder, Dan Hyman, Kieran Smith, Jake Nelson, Elliot Lyles, Nate Marquin, and Elizabeth Ryder, along with my brother Garrett and Dan Thompson for their work with editing and post-production. Special shout out to DermNet and Cockrell Dermatopathology for their help with clinical and histology images, along with Dermatographix for their high-yield dermatology sketches. Okay, so that's the list for now. I'm Logan Kolb. Thanks so much for listening, and we'll see you next time here in the Grenz Zone.
This episode is copyright 2020 Pro Podcasting LLC, all rights reserved. The Grenz Zone podcast is a service provided by Pro Podcasting LLC and is not affiliated with any other service providers.
Welcome to the Dermatographix for Seborrheic Dermatitis. Let's take a stroll through this winter wonderland, where the snowflakes aren't just falling from the sky, but also from the scalp. This middle-aged man reminds us that the Seb Derm peaks in the 4th to 6th decades and is more common in men. In front of him, the man with the furry mallet represents the increased presence of Malassezia furfur, hence the furry mallet. Altered sebum composition in the scalp can contribute to seborrheic dermatitis. To represent this, take a look at this bottle of yellow cholesterol oil, which symbolizes elevated cholesterol in the sebum. Notice that this man is also holding a tri-pronged pitchfork, which is our recurring symbol for elevated triglycerides, which is another component of the altered sebum. While triglycerides and cholesterol are elevated, squalene is decreased, as shown by this pig that is unable to squeal because of its muzzle. Additionally, free fatty acids are also decreased, shown by this cracked open bottle of acid spilling out. Seborrheic dermatitis can also affect younger patients, as shown by this baby. When it affects the scalp, it's typically known as cradle cap in babies, hence the baby's red cap. Seborrheic dermatitis can also affect the seborrheic areas like the scalp, face, postauricular, presternal, and intertriginous areas. So notice that these areas are exposed on the baby. Aw, poor thing, must be shivering. In adolescents and adults, seborrheic dermatitis has a similar presentation of pink-yellow patches with greasy scales in sebaceous areas, as symbolized by his greasy pink and yellow hat. He's scratching his head because, well, it's itchy, representing the itchy scalp that patients often experience. Are those snowflakes? Oh, it's just flakes of dandruff falling from above, representing the dandruff seen clinically. Sometimes seborrheic dermatitis can be refractory and may be difficult to distinguish from psoriasis. In these cases, a biopsy might be taken to help differentiate the conditions, which can exist on a spectrum known as sebopsoriasis. Irregular or psoriasiform acanthosis can be seen under the microscope, represented by the psoriatic skater with psoriatic elbow and knee pads. Notice that he has a pad on his shoulder, representing shoulder parakeratosis, which can also be seen. He's also holding a sponge to represent spongiosis. Walking on these frozen sidewalks can be dangerous. That is why this EMT first responder is standing by. He represents the first responders of the immune system, the neutrophils, which are seen in the cornified layer. This plate of spaghetti and meatballs represents the KOH findings, which can show spaghetti and meatballs of hyphae and spores, respectively. For treatment, let's take a look at the cycling ox, which represents cycloperox. Notice the pine cone in its basket, representing topical azoles that often end in conazole, hence the pine cone. Specifically, ketoconazole will be a mainstay for topical treatments, so remember the key that he is holding for ketoconazole. Inside the basket, there's also a bottle of blue shampoo, representing Selsun Blue for selenium sulfide. The bottle has zinc written on it, representing pyrothone zinc. Another over-the-counter anti-dandruff shampoo that can be used for Seb Derm. As an additional reminder, for pyrithione, take a look at the pie on the ground. When patients are itchy, topical steroids can also be added to the treatment regimen, as represented by the recurring hydrocooler. For refractory cases, topical roflumilast can also be used for treatment. Take a look at this woman with a Seb Derm cap rolling on the floor laughing, or ROFL for short. That's because ROFL is the first letters of roflumilast. Before we wrap up this sketch, let's briefly touch on prognosis. Notice that the baby is giving a thumbs up because infants usually have spontaneous resolution by 8 to 12 months. That is one happy baby. On the other side, the adults and adolescents look a lot more sad, representing the chronic relapsing course seen in these age groups. Patients with Parkinson's and HIV can have a higher incidence and severity of seborrheic dermatitis. This is shown by the man on the park bench, which represents Parkinson's. As an additional reminder, he is rolling a pill, as these patients often exhibit a pill-rolling tremor. His first aid kit reminds us of HIV and AIDS. Let's summarize this graphic. In this winter wonderland, flakes aren't just falling from the sky, but also from the middle-aged man's scalp, reminding us that Seb Derm peaks in men in their 40s through 60s. In front of him, the man with the furry mallet symbolizes Malassezia furfur. The bottle of yellow cholesterol oil and tri-pronged pitchfork highlight altered sebum with increased cholesterol and elevated triglycerides, which is another component of the altered sebum. While triglycerides and cholesterol are elevated, squalene is decreased, as shown by this pig that is unable to squeal because of its muzzle. Additionally, free fatty acids are also decreased, shown by this cracked open bottle of acid spilling out. A baby with a red cap reminds us of cradle cap, with exposed seborrheic areas emphasizing the seborrheic distribution. In adolescents and adults, the greasy pink and yellow hat symbolizes pink, yellow, greasy scales, while falling dandruff flakes highlight the classic scaling. Refractory cases may need a biopsy. Cue the psoriatic skater with psoriatic elbow and knee pads, representing irregular or psoriasiform acanthosis. His shoulders also have pads to represent shoulder parakeratosis, and he is holding a sponge for spongiosis. The EMT first responder represents neutrophils in the cornified layer. This plate of spaghetti and meatballs represents the KOH findings, which can show spaghetti and meatballs of hyphae and spores, respectively. Time to melt those flakes away with treatment. The cycling ox represents cycloperox, while the pine cone in his basket represents topical azoles that often end in conazole. The key he is holding signifies ketoconazole specifically. Inside his basket, there's also a bottle of blue shampoo, which represents selenium sulfide, or Selsun blue, and it is labeled zinc, to represent pyrithione zinc. On the ground, a pie serves as another reminder for pyrithione zinc. The hydro cooler represents topical steroids used for symptomatic relief. And for refractory cases, we see the woman wearing a seborrheic dermatitis cap rolling on the floor laughing, or ROFL, roflumilast. For prognosis, remember how everyone was feeling in the outdoors. The baby giving a thumbs up reminds us that infant cases usually resolve on their own by 8 to 12 months. However, the sad adolescent and adults indicate the chronic, relapsing nature of seborrheic dermatitis in these age groups. Lastly, the man sitting on a park bench, rolling a pill in his fingers, represents Parkinson's disease, a condition associated with the higher incidence and severity of seborrheic dermatitis. His first aid kit reminds us that HIV or AIDS patients are also at an increased risk. So there you have it, seborrheic dermatitis. Whether it's a passing storm in infancy or a lifelong blizzard, you'll be ready to weather it. Get it? Weather?